And back with another edition of WPSD Local 6 Live Line. We're visiting today with Brad Robbins, who is a physical therapist with Biokinetics Physical Therapy in Calvert City, Kentucky. And Brad, as I alluded in the tease a moment ago going to break, that a lot of you golfers out there, and being the weekend of a holiday with July 4th, I bet golf may be on the menu along with barbecue and fireworks. But when you get out there, you want to be at your best. You don't want to hurt. What are some of the more common injuries that you see with golfers? What's predominant there?
Well, Dave, I would say the most prominent injury for golfers is low back pain, and that's across the board. Obviously, we see a lot more right-handed golfers than left-handed golfers, and I would say if you're battling some low back pain, it makes it pretty tough to perform on the golf course.
What are some of the other injuries that you see? I would imagine, because you have not only your back and torso involved, but when you play golf, you've got wrists, shoulders, elbows. What else do you see? We see
a myriad of different injuries related to golf. Speaking specifically of a right-handed golfer, you see more left shoulder injuries, left wrist injuries, hip and knee. We see a lot. Those areas of the body take a lot of torque when you swing the golf club, and it would kind of just be the opposite for a left-handed golfer.
Are these injuries age-related? And I'm getting to the point now where, as I'm aging, I'm seeing more injuries just walking around the house. But are these age-related, or can any golfer of any age get these injuries?
Any golfer of any age can get these injuries. As you get older, obviously you kind of lose some flexibility. You lose a little motor control, and those are things that physical therapy can really help with. But anyone across the lifespan could develop an injury with poor movement patterns associated with the golf swing.
Let's talk a little bit about what you have to offer, because before we got on here today, you were talking about a specific protocol that is offered by you and the folks at Biokinetics, that you're trained in how to be able to help golfers through these injuries.
Yes, so recently I've obtained a certification in Titleist Performance Institute. I am a level 1 certified provider. Which basically means that I have a standard protocol that takes you through several different movement patterns that are necessary to swing the golf club efficiently. I'm not really teaching you how to swing the golf club. That's more for your local golf pro. I am just teaching your body. I'm evaluating your body to make sure that you are able to swing the golf club efficiently. When those movement patterns break down, that's where injuries occur.
Do you also have a number of maybe specific warm-ups that you should do in warming up your body to get ready to play? Because I've seen a lot of guys go out there, they don't warm up at all. They're kind of macho, and they just start swinging the club and go at it. I'm guessing that's probably a good way to get hurt.
Yeah, absolutely. A dynamic warm-up, you don't want to just jump out of the car and run to the first tee and swing the club. That's a recipe for disaster. A good dynamic warm-up, some ballistic stretching, meaning not just hold statically. You want to just get the arms moving, get the wrists moving, get the hips and knees moving, more of a controlled dynamic type of a warm-up for 5 to 10 minutes or so, and warm up slowly. Hit a few early wedges, hit a few mid-irons. That'll help you to warm up and get ready to hit the big stick.
Brad, you mentioned hips and knees, and many of you out there have probably had some pain with your hips and knees. You may have gone through a hip replacement or a knee replacement, and you all specialize in helping those folks as well.
Yes, sir, we sure do. We work with a lot of post-operative rehabilitation cases, and that ranges from carpal tunnel release to a hip or knee replacement, as you alluded to. The fantastic orthopedic surgeons that are in our area, they fix the diseased joints, they fix the severely torn rotator cuffs and tendinopathies. We help to restore the normal movement patterns that have been broken down through the course of your issue.
I remember when I had an ACL reconstruction about 25 years ago, and we've got about a minute left here, but I was told that the rehab and the therapy you go through can make all the difference between returning to a so-called normal life and maybe not having such a good result.
Absolutely. I'm a little biased, but I've seen firsthand the majority of cases of folks who go through rehabilitation after a surgery can make all the difference in the world in a high quality of life after a surgical intervention. And you have your choice of physical therapy places after a surgery.
So you do have a choice, but what about those people that are starting to experience pain, such as what we alluded to a moment ago with some of the golf injuries? Do they need a referral from a general practitioner to see you?
They do not. In the state of Kentucky, we have what's called unlimited direct access to physical therapy. The physical therapy is a doctoring profession now, so we have the education and expertise necessary to see if you require physical therapy or a referral to another medical provider.
Brad Robbins, physical therapist with Biokinetics in Calvert City, our guest on today's Local